Hey guys, welcome back to my channel. If you're new here, I'm Catherine, a medical student studying in Australia. In this video, I'm going to take you through my hospital rotation experience. My first rotation was orthopedic surgery, and I need to go to the operation theatre on every Tuesday and Thursday for the following 5 weeks. The surgery will start at 8 a.m. and all the staff, including me, have to arrive at surgical theatre at 7:30 for preparation. I only get to go to the operation theatre once back in Malaysia during my elective posting, and I did not have the chance to strap in during that time. Today I'm so excited because it will be my first day scrubbing in, which means that I'll be having clearer picture on what the surgeon is doing and also hopefully get to learn more out from the surgery. I'm heading back right now. I have online class, so I'm heading back home for my online class. Right now I'm walking home from the bus stop, and yeah, I have class at 2 p.m. and now it's already like 1:20 p.m. so I don't know whether I have the time to eat my lunch or not. So I went to see some surgery just now. Open carpal tunnel release and right ulnar nerve transportation, right trigger thumb release under local anesthetics, open repair right scapularis tear and biceps tendinosis, and also the right endoscopic carpal tunnel release. My doctor is quite helpful and he's like explaining and telling me all the structures and also doing the surgery at the same time. Right now I'm going to have my class online. So this class will be about gallbladder. Yeah, and it's like 1 hour and 30 minutes long. It's going to start soon. And I managed to have my lunch, which is good, so I don't have to starve throughout the whole online class. Inflammation. So there's neutrophils. Depends on whether it's acute or chronic. If it's chronic, then monocytes. I just finished studying what I had for the online class just now, and look at my table. It's so messy, and look at me, I'm so messy too. Now I'm just going to rest. Guys, I've arrived at my clinic. I'm going to show you guys like how good the place looks. While I'm in the hospital or clinic, I like to come up with learning objective based on what I've observed on that day and then study based on my learning objectives. And since I'm currently in my orthopedic surgery rotation, so many of my learning objectives involve knowing all the anatomy like bones, muscles, and joints. No matter how busy you are, exercise is really important to keep your body healthy and also your mind refreshed. Weekend is always the time for me to relax. I always like to make myself a decent breakfast during the weekend. Since I don't really feel like cooking every day during the weekdays after all the hustling from the hospital, I always like to prep some meals enough for the weekdays on Saturday or Sunday. I can't imagine if I stayed back. What would happen if... So right now I'm going to go to the hospital and see if there is any case of trauma. This is sort of like our logbook, and we need to get it signed off. Need to get my after hours shift signed off. So I need to complete minimum at least 24 hours in total. Although I don't feel like going to work on Saturday, but because normally I'm quite busy with my work, so I only left with Saturday and Sunday to do this. So I'm also going to the hospital to check the patient's files, because during my rotation I need to finish like 12 long cases, and I've already gathered all the patient's history and the examination, except that I do not have the radiography of the patient. So later I'll be going to the hospital to collect all the information so that I can present it to my supervisor and also get my long cases signed off. I like to feel prepared and look good every day, so putting on some makeup is like a daily routine for me. I like to study and do some pre-learn for a bit before I attend the classes. So for Wednesday, I don't have to go to hospital or clinic because it's considered as teaching day, which means that I will be spending most of my time attending lectures and teaching classes. And unfortunately, due to COVID-19, other classes are normally conducted through online, except for the clinical skills session. I'm being asked with a lot of questions by my surgeon and also the anesthesiologist, which I don't manage to answer. So I have kept a list of the questions that I'm not managed to answer on my notebook. Yeah, I'm quite tired. Like, I feel tired because I woke up very early to attend my rotation. Sometimes when you come back, you just don't feel like doing anything anymore. I think that sometimes it's okay if you feel that way. I mean, like, burning out is one of the things that I don't want it to happen to me currently, because I have too many things to settle, and I have to get used to all of the culture and how they do things here. This is the notebook that I like to scribble, and I'll write down what I need to do and my daily goal. I also use this notebook to like scribble all of the patient's detail while I'm interviewing the patient. So today is the last day of my orthopedic surgery rotation, and I have learned a lot of things from this rotation. I have seen different kind of patients. I have seen different kind of surgery. I'm still trying to get used to the culture here, and I'm still trying to like know different kind of people, and I'm still trying to learn how to speak with the native speaker. There's a lot of things has been going on since I arrived in Australia, and this is why I couldn't update my YouTube channel frequently. I am still so thankful that you guys are willing to support me and my channel. I will try my best to update my YouTube channel frequently. If you're really curious about how is it like to study in Australia, you can always message me on my Instagram. If you're really interested in me sharing my experience throughout my medical school journey, you can subscribe to my channel. Thank you for watching. Bye.